Good afternoon, everybody. This is Dr. Murli Bharadwaj, your classmate in everyday NEET PG preparation. Today is September 11th. Another 100 days before you are going to become the topper in the NEET PG. आज मैं आपके लिए एक अच्छा रिविजन लंच बॉक्स लाया हूं. Fatafat, another 15-20 minutes में we will try to revise almost 100 points, which are the hot points for the forthcoming NEET PG, once more in the subject of pediatrics. Milk secretion, it is the prolactin which will promote the secretion of the milk in the lactating women. Oxytocin, it will lead to contraction of the myoepithelial cells, leading to the ejection of the milk, is what you need to remember. So whenever the infant suckles the mother's breast nipple, it is the stimulus to let down, and that is maintained by the oxytocin, is what you need to remember. Now, abhi kaam ki baat kare. What are the contraindication? Baby is crying but mother cannot give breastfeeding. Very important. You should remember galactosemia, contraindication to breastfeeding. Mother who has active TB, HIV in the developed countries. In the developing countries, maternal HIV is not a contraindication. Whereas in developed countries, maternal HIV is a contraindication of breastfeeding. Very important to remember. Lithium, anti-thyroid drugs, cytotoxic drugs, anti-cancer drugs, any congenital lactose intolerance, they are all considered to be the contraindications. Abhi examiner एक serious question पूछेगा. Twist वाला question पूछेगा. क्या? What is the twist? Mother is HPS-AG positive. Do you think it is contraindication? No, sir. HCV? No, sir. CMV? No, sir. If there is any fever in the mother, still she can breastfeed. It is not a contraindication. Tobacco smoking in the mother is not a contraindication. Now, doctor, कुछ दूध की बात करेंगे. दूध वाले की important issues क्या है? Milk is a good source of all vitamins except vitamin K. That is the reason the breastfed infants are more susceptible to the hemorrhagic disease of the newborn because of this vitamin K deficiency. Breast milk is also deficient in vitamin B12 if the mother is a strict vegetarian. Similarly, breast milk is deficient in vitamin D, vitamin K and fluorides. Please don't forget. So, if you take any preterm baby or a very low birth weight baby, they require more calories, more energy, more quick growth. For them, only breastfeeding is inadequate. Now, what is human milk very rich in? It is very rich in glutamic acid and deficient in glycine. Deficient in glycine is what you have to remember. Next, doctor, pyloric stenosis. 10 points about pyloric stenosis because this is a common topic for both pediatrics and also for general surgery. Now, doctor, formula feeding, those kids who are receiving formula feeding, it will gradually lead to hypertrophy of the pylorus. And that is the reason the symptoms will appear at the age of 3 to 5 weeks is what you need to remember. Once more, if you compare formula-fed infants versus breastfed infants, formula-fed infants have a slower gastric emptying. Both slowly gastric emptying hota hai. That's the reason they consume more volume in less time, and the increased gastric burden in turn will stimulate the growth of the pyloric muscle, which is the underlying basis why the formula fed infants have a greater incidence of the pyloric stenosis. Pyloric stenosis क्या होता है डॉक्टर? आपका stomach है ना? So stomach is entering into duodenum. It is here that you have the pylorus, which become hypertrophied in these people. Now, doctors, what is the pathophysiology of the dyslipidemias that you see in congenital hypertrophic pyloric stenosis? उल्टियां होते हैं pyloric stenosis baby में, that lead to loss of gastric HCl, and that lead to metabolic alkalosis and hypochloremia. वो एक रीजन है. दूसरा रीजन क्या है? Why do they get metabolic alkalosis? When there is a continuous vomiting, there is a loss of NaCl and also water. That lead to hypovolemia, that decreases the renal perfusion, and that increases the angiotensin too, and that will increase the aldosterone. Aldosterone का action क्या होता है डॉक्टर? ये आपका glomerulus है, समझो, ठीक है? तो this is the collecting duct. So collecting duct के ऊपर aldosterone काम करेगा. Aldosterone will cause sodium retention, potassium loss, H plus loss, and the loss of the H plus lead to metabolic alkalosis. Loss of potassium lead to hypokalemia, and there is a retention of sodium. So this is how there is a development of metabolic alkalosis, hypokalemia in the baby who is having congenital hypertrophic pyloric stenosis is what you need to basically remember. Abhi bhaiya 10 points बोलो, फटाफट बोलो. First born baby is a risk factor for the pyloric stenosis. राम को pyloric stenosis होगा, लक्ष्मण को नहीं होगा. First born erythromycin is a risk factor. Formula feeding is a risk factor, please don't forget. And what type of emesis, doctor? Non-bilious emesis. Non-bilious emesis. How does it present? The baby will present with a poor weight gain, dehydration, and if you happen to palpate, a olive-shaped abdominal mass is the classical feature. There is a hypochloremic metabolic alkalosis along with hypokalemia is what you need to remember. And what is the best investigation to detect that olive-shaped abdominal mass? Abdominal ultrasound. And the treatment is rehydration and then do pyloromyotomy is what you need to remember. Khatam. आप लोग perfect हो गया अभी congenital hypertrophic pyloric stenosis में. Like this, 10 points in every topic, doctor. 953 topics are available, which are the most high-yield topics from which examiner is going to ask 300 MCQs. कितना देर लगेगा डॉक्टर एक टॉपिक का important points, things to buttify, what are the twists समझने के लिए? Not more than 15 to 20 minutes, right? So www.onlinembbs.com के ऊपर आपको वीडियो लाइब्रेरी मिल जाएगा. आप आराम से रिवीजन करो, पावर पॉइंट्स मिलेगा, वीडियो मिलेगा आपको, और डॉक्टर मुरली भारद्वाज आपका साथी भी मिल जाएगा आपको, ठीक है? सो डोंट फॉरगेट, प्लीज कॉल 9008688356, our helpline number, in order to get an access to the video library. Now, commercial break के बाद अभी बात करेंगे कोलिडोकल सिस्ट के बारे में. एक कोलिडोकल सिस्ट होता है cyst in the bile duct. Bile duct. It is not the cyst in any other duct, bile duct. It can be congenital, it can be acquired. Typically, it presents like a right upper quadrant mass. It leads to a slightly elevated amylase and lipase, like any other biliary disease. But biliary cyst, choledochal cyst जो होता है, it is a risk factor for the cholangiocarcinoma. This is the MCQ. Examiner will ask. Examiner एक गन पकड़ के पूछेगा, बोलो रामू, कोलिडोकल सिस्ट में कोलेंजियोकार्सिनोमा होता या नहीं होता, होता या नहीं होता? You should tell very firmly. It happens, sir. Cholangiocarcinoma happens. There can be an infection of the choledochal cyst. There can be pancreatitis. Any of them can happen is what you need to remember. Now, what are those 5 important twisting the list about biliary cyst, doctor? Type 1 most common. It is not 2, it is not 3, it is not 4. Oh, kya hai bhai? What are they? Also not important for you. Because for entrance exam, only one thing you need to remember. Biliary cyst is 1, type 1 is most common. फिर भी आपको enthusiasm है तो try करो. Google images, Google में जाके search करो. आपको 1 क्या, 2 क्या, 3 क्या, सब कुछ मिलता. Balian love में भी मिल जाता. But 1 is most common. Please don't forget. Typically it is extrahepatic. Biliary tree liver के अंदर भी होता है, बाहर भी होता है. अंदर से बाहर हम आ सकते नहीं आ सकते. बाहर वाले biliary tree में cyst develop होता है. ठीक है? So cystic dilatation of the bile duct, typically extrahepatic. It is single. Married नहीं है, single. Now what are the clinical manifestations? What is the clinical triad of biliary cyst? कौन बोलेगा? हाथ उठाओ. Pain, jaundice, palpable mass. Pain, jaundice, palpable mass. Majority of the cysts present in the age less than 10 years. That is the reason हम pediatrics में इसके बारे में बात कर रहे हैं. Diagnosis, you have to do ultrasound to visualize and ERCP endoscopic retrograde cholangiopancreatography करके पूरा biliary tree का स्ट्रक्चर को विजुअलाइज करके वहां सिस्ट को पहचानना पड़ेगा. What is the treatment? You have to do the surgical resection to relieve the obstruction and prevent the, what is the big tension? Malignant transformation को. Malignant transformation is the biggest risk that you are all worried about. Fatafat. Next, doctor. Third reel in our Sholay movie, Meckel's diverticulum. इसके बारे में 10 points बोलो. तुम बोलोगे या मैं बोलो? तुम बोलोगे या मैं बोलो? अच्छा ठीक है. Best way to prepare for entrance, doctor. 3-4 शिष्य के साथ बैठो. नन्नू, मुन्नू, चिन्नू, 4 फ्रेंड्स के साथ बैठ के फट रिविजन करना है. Like AK-47 rifle, you have to shoot the important points, twists, etc., etc. Now, doctor, what is the rule of 2s when we talk about the Meckel's diverticulum? 2 is 2% prevalence. 2 is 2:1 male-female ratio. 2% are symptomatic at the age of the 2. It is located within the 2 feet of ileocecal valve. The rule of 2, don't forget. A Meckel's diverticulum, sometimes, a good number of times, is a asymptomatic incidental finding. आप हाउस सर्जन हैं, appendectomy पहले बार देख रहे हैं, तब आपको Meckel's diverticulum मिल गया, appendicitis बोल के अगर आप ऑपरेट करें तो. सो asymptomatic incidental finding. It leads to painless, not painful, painless hematochezia is what you need to remember. Meckel's diverticulum can also be the leading point for the intussusception, intestinal obstruction. It can lead to volvulus is what you have to remember. इतने लंबे intestine में इतना छोटा Meckel's diverticulum को कैसे पकड़ेगा आप? रेडियो न्यूक्लाइड का इस्तेमाल करना पड़ता है मेरे भारतवासियों. Technetium 99M per technate scan is a diagnostic investigation of choice. And how do you treat, doctor? Symptomatic है तो काटो, सर्जरी करो. खत्म Meckel's diverticulum. अभी नेक्स्ट टॉपिक है सिलियाक डिजीज. गर्मा गरम समोसा मिल रहा है, आ जाओ आ जाओ आ जाओ. नाउ रिस्क फैक्टर्स. व्हाट आर द रिस्क फैक्टर्स फॉर सिलियाक डिजीज? हमारे रिश्तेदारों में कोई सिलियाक डिजीज वाले हैं तो हमारा नसीब भी खराब हो जाएगा. फर्स्ट डिग्री रिलेटिव्स, ऑटो इम्यून थायराइडिस, टाइप 1 डायबिटीज, because they are all autoimmune phenomena. Celiac is also autoimmune. Down's syndrome, very important. Selective IgA deficiency is what you need to remember. Risk factors. भैया what are the symptoms? Celiac disease है तो कैसे पता चलेगा? पेशेंट क्या बोलेगा? पेट में दर्द डॉक्टर साहब, एब्डोमिनल पेन, nausea, diarrhea, only rarely constipation. Diarrhea is more common, rarely constipation. Flatulence, bloating. Then extraintestinal, what are the symptoms? Obviously there is a malabsorption because of the celiac disease, इसलिए short stature, weight loss, iron deficiency or dermatitis herpetiformis. What is dermatitis herpetiformis? एक्सटेंसर सरफेस के ऊपर, एल्बोस रहता है ना डॉक्टर, राइट? एल्बोस के ऊपर आपको लीजन्स होता है डर्मेटाइटिस herpetiformis का एक्सटेंसर सरफेस के ऊपर. सो हाउ डू यू मेक a diagnosis of celiac disease? There is an increased tissue transglutaminase IgA levels, increased anti-endomysial antibodies. एंड अगर आप डिओडिनल बायोप्सी करें तो टिपिकली विलाई होता है ना डॉक्टर, विलाई, ये विलाई आर ऑल फ्लैटेंड विलाई. इंक्रीज्ड इंट्राएपिथेलियल लिम्फोसाइट्स, बहुत लिम्फोसाइट्स बिकम एक्यूमुलेटेड एंड showing that flattening of the villi, increased intraepithelial lymphocytes on the duodenal biopsy is the way you will make a diagnosis of celiac disease. अरे वाह, हम 3 टॉपिक्स खत्म कर दिया, बढ़िया. नाउ डॉक्टर रेइस सिंड्रोम. सी डॉक्टर, आई एम टेलिंग यू स्टडी किया बोले तो इसका मतलब आप बड़ा वैद्य बन गया नहीं है. समझ में आ गए ना? बड़े बड़े बुकों में, बड़े बड़े लंबे लंबे कागजों में लंबी लंबी पैराग्राफ्स पढ़े तो अल्टीमेटली इसका तात्पर्य जो होता है, द समरी, द प्रेसिस, that is what you have to catch, doctor. So that is the reason, read less, understand, know what examiner is going to ask, attack the exam. That is going to be the strategy. आप किसका स्टूडेंट्स हैं? डॉक्टर मुरली भारद्वाज का, राइट? हम पढ़ के अच्छा रैंक पाके पप्पा कहते हैं हम बड़ा एमडी करेगा, ठीक है? नाउ डॉक्टर रेइस सिंड्रोम, इसके बारे में बात करो फटाफट. इन्फ्लुएंजा भी और वैरिसेला जोस्टर इन्फेक्शन हो गया तो विदाउट नोइंग दैट इट इज दैट, इफ यू हैपन टू गिव एस्पिरिन, एसिटाइल सैलिसिलिक एसिड, that acts like a mitochondrial toxin, it lead to acute fulminant hepatic failure and lead to metabolic encephalopathy, which is the way you get Reye's syndrome, is what you have to basically understand. अच्छा भैया, Reye's syndrome के बारे में 10 पॉइंट्स बोलो, गर्मा गर्म पॉइंट्स बोलो. माइक्रोविसाइकुलर फैटी इन्फिल्ट्रेशन है हुजूर, मैक्रो नहीं, माइक्रोविसाइकुलर फैटी इन्फिल्ट्रेशन. मैं इसके पहले एक वीडियो बना के दिया आपको, कॉजेस ऑफ द माइक्रो, कॉजेस ऑफ द मैक्रो, कॉजेस ऑफ बोथ is the favorite topic of the examiner. Please do a revision of that, right? Microvesicular fatty infiltration. Then hepatic mitochondrial dysfunction. क्यों? एस्पिरिन जो होता है, it is a mitochondrial toxin. What is the etiology? using the aspirin in a pediatric patient in the setting of influenza or varicella infection is responsible. How do they present? Encephalopathy and acute liver failure. लिवर फेल्यूर है इसलिए ट्रांसएमिनेसिस बढ़ गया, लिवर फेल्यूर है इसलिए पीटी बढ़ गया, आईएनआर बढ़ गया, पीटीटी बढ़ गया और हाइपर अमोनिया में के जैसे एनकेफेलोपैथी हो गया. So that is what you have to remember. Reye's syndrome, micro, not macro. Please don't forget. अच्छा भैया. Necrotizing enterocolitis. इसके बारे में 10 points. Let us do the boxing show. Now, doctor, what are the risk factors? Why should a child should get necrotizing enterocolitis? Prematurity, very low birth weight, reduced mesenteric perfusion because of the hypotension or any congenital heart disease can lead to development of, obviously ischemic injury lead to necrosis. Necrosis involves the colon, isliye necrotizing enterocolitis happens in hypotension or any congenital heart disease, decreasing the perfusion to the gut. Any enteral feeding, typically formula feeding, has a greater chance of leading to necrotizing enterocolitis than the breast milk. You should remember. Now, what are clinical features? भैया एंटरॉन और कोलॉन दोनों नेक्रोज हो गया. So that is the reason there will be instability in the vital signs, hypotension, lethargy, GI, you will have vomiting, bloody stools, abdominal distension, tenderness. These are all the clinical features of necrotizing enterocolitis. If you happen to do the X-ray abdomen, क्या हो जाता डॉक्टर? ये इंटेस्टाइन है. वेरी गुड. सो अगर नेक्रोसिस हो गया तो क्या हो गया? गैस फॉर्म हो गया. गैस फॉर्म्ड इन द वॉल ऑफ द इंटेस्टाइन. इसको कहते हैं न्यूमेटोसिस इंटेस्टिनालिस. And that gas has percolated into intestine is connected with whom? Liver. So liver के अंदर चले गया, इसलिए portal venous gas. Favorite question. Portal vein intestine से निकलता है ना? Mesenteric vein and splenic vein together form portal vein. So a mesenteric vein will bring those gas bubbles of the intestinal wall into the liver. Hence portal venous gas अगर दिखाई दिए तो वो किसके वजह से होता है? नेक्रोटाइजिंग एंटेरोकोलाइटिस के वजह से होता है. फेवरेट क्वेश्चन ऑफ एग्जामिनर. समटाइम्स देयर कैन बी न्यूमोपेरिटोनियम. सो हाउ डू यू ट्रीट डॉक्टर नेक्रोटाइजिंग एंटेरोकोलाइटिस? सपोर्टिव केयर. यू हैव टू गिव रेस्ट टू दैट बबल. यू हैव टू गिव पैरेंटरल न्यूट्रिशन एंड ब्रॉड स्पेक्ट्रम IV antibiotics. Depending upon the extent and severity of the necrotizing enterocolitis, you need to take a call whether to do surgery or not. Now, what are the complications? It can lead to septic shock, intestinal strictures, short bowel syndrome. 40% of cases. छोटू बच्चा है, necrotizing enterocolitis हो गया है. Up to 40% it can lead to death. So that is the reason, doctor, entire little babies across India, कश्मीर से लेके कन्याकुमारी तक और राजस्थान से लेके महाराष्ट्र तक आपके लिए प्रतीक्षा कर रहे हैं. डॉक्टर बाबू MD में सीट आएगा और मेरे छोटे नन्हे मुन्ने बच्चे को नेक्रोटाइजिंग एंटेरोकोलाइटिस से बचाएगा बोल के वेट कर रहे बेटे. So that is the reason, doctor, always remember, you are born with a purpose to become a great man and a great topper. इसलिए भगवान जो आपको बनाया, आपको डॉक्टर बनाया, अभी बड़ा डॉक्टर बनने के लिए ऊपर वाला ही आपको पूरा शक्ति देगा. Only thing is you need to help the God to help you. Right, doctor? And I am the medium between the God and you. Okay? Now, Intussusception. That pathological lead point. Intussusception, normal type of intussusception हो सकता है, मगर pathological lead point you should always suspect in, especially intussusception when it occur in older children or with a recurrent intussusception, you should suspect a pathological lead point is what you have to remember. So what is that pathological lead point? It is the Meckel's diverticulum, which is the most common congenital anomaly of the GIT, which can be asymptomatic between the episodes of telescoping and can lead to development of intussusception. And whenever intussusception is there, Meckel's diverticulum is there, you have to do surgical resection to treat and prevent the complications of obstruction. Acha bhaiya, 10 points Dr. Murali Bharadwaj के quick 10 bullets बताओ जो NEET PG में कल पूछेगा. What are the risk factors of intussusception? Any recent viral illness? Rotavirus vaccination? वैक्सीनेशन दिए तो भी इंटुससेप्शन होता है. टू मच है ना, टू मच है. इंटुससेप्शन में यस यस, वैक्सीनेशन में सी सी बोलना मत. रोटावायरस वैक्सीनेशन कैन प्रिडिस्पोज टू इंटुससेप्शन. What are the various pathological lead points? Meckel's diverticulum, Henox-Carlin purpura, celiac disease, intestinal tumor, polyp, anything can be the pathological lead point. How will be the clinical presentation of the patient? Classical question, doctor, in NEET PG entrance, last 25 years में यही question पूछता. A child 2-year-old comes with an episodic crampy abdominal pain. She has drawn her belly towards her abdomen and crying, and she has currant jelly colored stools. Then you will think of intussusception. And a sausage shaped abdominal mass. Sausage shaped abdominal mass is the one found in the case of the intussusception. इंटुससेप्शन में क्या हो रहा है? एक इंटेस्टाइन के अंदर another intestinal segment protrude होने की कोशिश कर रहे हैं. इसलिए if you happen to do ultrasound, you will find a target, intussusceptum and intussuscipiens दोनों मिलके आपको टारगेट साइन दिखाएगा अल्ट्रासाउंड में. How do you treat, doctor? Enema, air or water soluble, and surgical removal of the lead point if it is present is considered to be the management of choice. Now, doctor, the next quick topic for us, gastroschisis. It is the sonography, T2 sonography, 95%, more than 95% sensitive to detect the abdominal wall defects. In gastroschisis and omphalocele and all these abdominal wall defects, maternal serum alpha fetoprotein is typically elevated. Gastroschisis will cause the bowel to become exposed to amniotic fluid, that lead to inflammation and the edema of the bowel, and that increase the risk of the complications like necrotizing enterocolitis and short bowel syndrome. Then there is a dysmotility of this gastroschisis that lead to ileus, delayed gastric emptying, intolerance to the feed, and that will lead to a dependence for a longer period of time on the total parenteral nutrition. That is what you have to remember. Now, doctor, very important question. Gastroschisis किसी और के साथ होता या अकेले होता? What are the differences between gastroschisis and omphalocele? Favorite question of the examiner. More than 90% of cases it is an isolated defect. No associated anomalies or neural tube defects. So how do you treat, doctor, after delivery? After delivery, that exposed bowel should be covered with sterile saline. Examiner आपको बहुत temptation देता. सलाइन लगाते, वैसलीन लगाते, अमृतांजनम लगाते, क्या लगाते उस गट को बोल के आपको पूछेगा एग्जाम में. आप क्या आंसर करते हैं? स्टेराइल सलाइन ड्रेसिंग, प्लास्टिक रैप एंड इमीडिएट सर्जरी इज ऑल दैट इज रिक्वायर्ड. सो दैट इज द स्टोरी ऑफ गैस्ट्रोस्किस. बराबर. नाउ डॉक्टर, बिलियरी एट्रीसिया, बाइल डक्ट ब्लॉक हो गया. हाउ डू यू आइडेंटिफाई बिलियरी एट्रीसिया? Congenital biliary atresia presents with conjugated hyperbilirubinemia. there is more than 2 milligram per deciliter of direct bilirubin or 2 milligram per deciliter of direct bilirubin, or if the direct bilirubin fraction is more than 20% of the elevated total bilirubin, that you call it as conjugated hyperbilirubinemia. And any newborn, अगर उसको conjugated hyperbilirubinemia है, hepatomegaly है, he need an immediate evaluation for biliary atresia. How do you evaluate, doctor? Abdominal ultrasound, ये होता है first step. Then it will show, what will it show if there is a biliary atresia? यहाँ liver है ना, यहाँ से biliary tract आ रहा है, यहाँ gall bladder है, gall bladder will also drain through the cystic duct into biliary tree. So अगर biliary atresia है तो there will be either abnormal or a small or an absent gall bladder, which you will detect in the abdominal ultrasound. So that is the reason, if the examiner asks a question, a newborn with conjugated hyperbilirubinemia with hepatomegaly on abdominal ultrasound found to have an absent gallbladder, we should think of biliary atresia. And what is the early treatment? Kasai procedure. It will dramatically improve the outcome. Now, Kasai is basically a temporary procedure, right? And it decreases the morbidity and the mortality, but ultimately you have to do definitive procedure which is called liver transplantation. So biliary atresia is an indication for liver transplantation. अभी फटाफट review points बोलो. 5 minutes में आंख बंद करके टक 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 you should finish. Initially well appearing, followed by the development of jaundice over 1 to 6 weeks, 1 to 8 weeks. Initially a well appearing newborn, सब लोग ताली बजाया, मिठाई बांटा, बच्चों को लेके घर आए. Then 1 to 8 weeks, there is a development of jaundice, pale stools, hepatomegaly, conjugated hyperbilirubinemia, mild elevation of transaminases. That are the classical clinical features. Ultrasound में absent or abdominal gallbladder. So how will you identify that there is a biliary atresia? You will do hepatobiliary scintigraphy. अगर hepatobiliary scintigraphy करे तो, right? HIDA, PIPIDA, you know all those scans, no? HIDA, PIPIDA. Actually, we have done a detailed discussion in onlinembbs.com, doctor. onlinembbs.com. मैं और एक बार बोल रहा हूँ. Take an opportunity. गर्मा गर्म 953 topics are there. You will hardly need to invest around 400 to 600 hours of your time. More than enough. Right? Another 100 days में 600 hours रोज 6 घंटे. आपको पावर पॉइंट्स हैं, ब्यूटीफुल पिक्टोरियल रिव्यू हैं, सो यू कैन बी एबल टू हैप्पीली एंजॉय टू डू द रिविजन. बट फिर भी दिस इज ए मोर क्रिस्टल क्लियर समरी. बहुत छोटा करके फट 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 आपको खिला रहा हूं. चांदनी को दिखाते हुए मैं आपको कर्ड राइस खिला रहा हूं. ठीक है बेटा? हाँ. नाउ लिवर बायोप्सी. What does it show in biliary atresia? There is a extended portal tract with bile duct obstruction, proliferation, portal tract edema, fibrosis, inflammation. नहीं तो क्या दिखाएगा? वही दिखाएगा. Intraoperatively cholangiogram, contrast को भी जाओ. This is considered to be gold standard. Please don't forget, examiner gold standard and standard of reference. अजीब बातें पूछते हैं. Specific investigation, earliest investigation, first investigation, these are all important to be caught, right? So what is gold? Gold standard क्या है डॉक्टर biliary atresia के लिए? Intraoperative cholangiogram is considered to be the gold standard, is what you need to remember. Now how do you treat? Kasai procedure, hepatoportoenterostomy. हेपेटोपोर्टोएंटेरोस्टोमी. बाइल डक्ट का काम क्या होता है डॉक्टर? बाइल को लाके इंटेस्टाइन में ड्रॉप करना उनका काम है। अगर वो बाइल डक्ट ही एट्रिटिक है तो व्हाट इज द ओनली वे? डायरेक्टली टनल डाल दो, महाराष्ट्र का वाटर तेलंगाना में, तेलंगाना का वाटर आंध्रा में चले जाएगा, राइट? सो पोर्टो hepatoporto enterostomy is considered to be is called as concise procedure, and it is an indication for liver transplant is what you need to remember. So that brings us to the end of the today's journey, doctor. Let me tell you, 100 days, 100 golden days, very much enjoyable, doctor. हम साथ में मिलके पढ़ेंगे, and every day I will give you some quick summary to push your preparation, some extra multivitamins के जैसे. और evening 7 p.m. to 11 p.m. please don't forget to log in into live YouTube broadcast on the online on the YouTube channel of the online MBBS, and we will have a quick review discussion. And please don't forget to join WhatsApp study group. You have thousands of students. You will discover a lot of study mates, and you can share a lot of notes and MCQs, everything. You will get brilliant guys on the WhatsApp study group. So please don't forget to call our helpline and join. Good luck and enjoy the preparation. Don't forget you are not alone there. You have Dr. Murli Bharadwaj every day spending time with you. Thank you very much.